Hi, everyone. I'm Lisa Nichols, the Brain Health Nurse Practitioner here at Loom. I'm excited for your participation in our Brain Map Baseline Day. This event gives us a unique opportunity to assess your child's brain function and identify any disruptions in brainwave activity that may affect how your child thinks, learns new things, feels emotions, processes information, and even sleep. Having this baseline on file also allows us to monitor their brain development and identify changes from their baseline over time. For example, if your child suddenly starts struggling in school, starts experiencing persistent mood changes, or has a head injury during play or sports, we can repeat their brain map and assess for any changes or new disruptions. I invite you to view the attached video by Dr. Kevin Murphy, a radiation oncologist and founder of Peak Logic, the software which allows us to obtain the detailed brain map and provide personalized treatment protocols when indicated. Dr. Murphy is a pioneer in the field of brain health, and I hope you find the information helpful. He has included a segment around minute 24 of the video specific to the development of the brain in children, what we expect to see during these ages, and common disruptions we also see. I encourage you to have your child's brain map in front of you during this segment to help you understand things more. We hope that your child is healthy and doing well and continues to do well. But if you do have concerns about your child's brain health, either now or in the future, we welcome you to visit our website or call our office to schedule a more detailed brain health evaluation to discuss your specific concerns. Since your child is participating in this special Brain Map Baseline event, their evaluation will be offered at a discounted fee of $250, so please mention this if you call to schedule an appointment. Thank you for watching, and we look forward to seeing you soon.
Thanks for inviting me to talk to your audience. I would actually be there today. I'm in Carmel, Indiana, but can't make it today. But I wanted to go over some of the work we're doing and talk to your various parents and those that can have a chance to see this about the personalized way to treat the brain. I have a lot of ties to Indiana. My wife's from Fort Wayne. I went to Notre Dame back in the 80s. My mom's from Mishawaka, actually. And my father and mother met at Notre Dame back in the 40s. And I went to school there and went to ROTC in the Navy. And then now I'm out in San Diego as a oncologist, radiation oncologist, but I also do this TMS work, which you'll see, called PRTMS. We personalize a repetitive form of transcranial magnetic stimulation. And I can show you some of this video here. This is a picture of me treating the pediatric population. This is back probably 10 years ago when I had more hair, younger looking me. I made this mask device on the right, which was a replacement for the Gamma Knife system on the left. We would then track our pediatric patients and look at their position during a thing called radiosurgery. That was a way to sort of hit a high target in the brain and not create any injury to the brain. Once we're happy with the position, we would radiate with an X-ray beam. This is a historical way of doing it with a high dose to a small target. You see the machine moving around the patient, giving us a high dose there to the aperture and tumor target. The dose would be spread a bit outside of our target in this case, and you see a little bit of this sublethal damage. So when neurons were close enough to our target, we were still seeing some effect around that adjacent brain, and that was something we wanted to fix. Once those neurons are traumatized, they slow down. Under any trauma, neurons slow down. They lose their frequency. They gain what we call noise. This creates a thing called a brain arrhythmia, which is a dysregular frequency match with neurons gradually floating off the field like a marching band, gradually having various members make the wrong song as they meander off the field. The goal is to realign those systems. And we do this with a technique called TMS therapy. Peak Logic was founded to make this automated for the military originally as a decision-making tool. Dr. Clower's office is able to take the technology we've created and deliver a dose of therapy to his patients as an outpatient. This work was highlighted in the G20 summit. I spoke at this about 2 or 3 years ago, and this spread across the country pretty rapidly, the work we do. maybe 80 to 100 centers around the country using the software that I'm going to show you in a minute. About 30,000 patients have received therapy since 2016, and we have 120,000 EEGs. We call these spectral, and I'll walk you through what that means. About 1,000 people a day being treated across the country. A lot of the work was done through athletes and performance training for the NFL, for the UFC, and various groups. We're treating the Austrian ski team right now, the Olympic team. I treated Notre Dame football. I was a team physician in the 2017 through 20 timeframe for performance improvement and a history of concussion, better sleep, and a lot of other benefits were seen in that population. So the work we do is fairly simple. We do a wireless Bluetooth EEG. This is what you're seeing here. The cap is placed on the head. It takes about 5-10 minutes to get a scan. That scan then is going to give us first brain waves. Each one of those little areas on that cap, each little pod is measuring the brain frequency underneath. And we get first the analog signals showing us, in this case, the theta and delta wave states, which are very slow states. The x-axis tells you how many times per second does the brain fire. A 3 or 4 times per second deep sleep. A 5 to 7 times per second light sleep. All that is sleep in that yellow box. When you go above that, you go into a alpha state, 8 to 15 hertz. This is the place you are when you're calm, collected, when you're meditating, prayer state, mindful state. That's the state I want to amplify in all of our patients. I want to make that area tight and clear. I don't want neurons going fast like this. This is too fast, agitation, irritability, rage. This is this really fast state. You want them when you're being chased by a lion, but then you want to recoil back to this nice, calm place. So we're going to emphasize that position. The old way of reading this was very cumbersome. We would take all 19 brain locations. We would look at the analog signal from every location. Every vertical blue line is 1 second in time. And we're looking at how many times per second does the brain fire. And instead of that, we've luckily have math and computer systems, and we do FFT analysis, fast Fourier transform, and we can look at the signal to noise ratio. The signal being the peak power here in red, and the noise being everything else in blue. So at each location, I can say, what is the signal in red and how much area is noisy, not in line. And we look at it is through this diagram. You'll get a picture of this by Dr. Clower's team. This is made instantaneously following your EEG. On the left, you see the waveforms in the old way of showing it. In the middle here, this rainbow pattern shows you the peak frequency, 10.7. We can see that this distribution 0 to 20 hertz, that's 0 to 20 times per second. 10.7 is 10.7 times per second. You can see that most of the neurons are lining up on the field at that measurable position, and they're firing, playing that song, 10.7, which is nice alpha state. There are some regions that aren't making that pretty sound. If you look at down at P8, it's not making a wave. PZ 3 and 4 in yellow and orange, those are nice clear signals. T4 is noisy. So the interval under the curve or the coloring left of our peak is going toward too slow. Right is going too quickly. In this case, both are occurring. That's hearing loss with ringing in the ears. P8's nighttime vision, so the nighttime vision's poor because there's no field of strength there in the alpha domain. So each one of these areas has a story about its potential phenotype or how the patient manifests. In this case, this is largely coherent, which means the front, middle, and back are on the same frequency. They're lining up at 10.7. There are some noisy areas. The odd numbers are left side of the brain. The even is the right side of the brain. The front here in blue, the green being the middle, the red, orange, yellow being the back. So you're seeing all 19 brain locations on that cap now shown to you, represented as a function of frequency and power. This would be a pretty harmonized synchronous patient with most neurons firing at the right frequency in that middle peak, but there is some noise, some areas to clean up. In perfect scenarios, you can see even better views of that. This is another example of what each area means. The first lead, FP1, is a awareness and vigilance area. If I see slowing there, it's hard to pay attention for that patient. If that patient has fast neurons in the attention span, then they're hypervigilant. If the impulse control area is slow, they procrastinate. If it's fast, they can be impulsive. So the brain speed alone tells you a likelihood for behavior or a propensity of the patient. In this case, again, there's a nice signal top to bottom. Most neurons are firing at the right frequency, but there is some noise throughout the system here. In a perfect meditator, we see very little noise. We see just signal, which is this peak at 10.2. Every one of her areas in her brain are firing at the exact same frequency. That's what we see in patients who have practiced meditation, in her case, for 25 years. Very, very coherent alpha state creation here, very clean system, very efficient. That's what we're looking for. We all don't have 25 years to practice meditation, but we can sort of push it toward her position electrically by using a mild brain stimulation. I'll show you how we do that. But this is sort of what we're looking for. This is the end of the math equation. The computer is trying to make everyone look like her, where she spent many years getting there, practiced quietness, where the system is very, very efficient. All of us fall in this range of 9 to 12 hertz when we go to this nice calm place. She's 10.2. I'm 10.6. We're all a different number. And under injury, we see differences in these waveforms. So you can see here that the blue area on the top, which is a thinking, judging, planning region, has lost the nice tight signal and gained noise. This is following a trauma where now they have brain fog. Areas that do thinking, judging, planning have shown disruption. If you look at the motor areas, the motor sensory regions, the balance may be off with this sort of distribution. Again, we've lost the signal in some cases and gained noise, a lot of color under the curve. And the back of the brain where the injury occurred, you can see a posterior concussion. We even lost the signal, and all the neurons are left going toward the sideline, going to sleep. This is a disrupted case where all that's in place. The patient has brain fog, their balance isn't so great, and they're also seeing poorly or having light sensitivity. On the right is the correction using PRTMS. We're improving the signal, which is the peak, tightening up those waveforms, and taking out noise. And that combination really leads to better performance, sleep, less anxiety, etc. In a blast injury, when I see my veterans, we have these concussions that are global. The whole system has lost its waveform. If this were a marching band, they're spread throughout the entire field, making lots of noise. They've lost their signal. It took us 4 weeks in this case to restore that signal. And by 6 weeks, we see even better, powerful signal. Sometimes we don't do anything wrong. We just have a baby. And next thing we know, we're having postpartum depression. You can see what happens to the brain under a lack of hormone that's very abrupt. The system starts to slow. The blue areas are going to sleep. So are the green regions. So the whole front cortex is going down in speed. And that's creating brain fog as the whole system goes to sleep. You can see the disruption and noise here we need to correct. In TBIs and PTSD, we see the very similar pattern. The band is spread across the field. There's interval of color everywhere. We're going slow and they're going fast. So in some cases, they can't pay attention, but they're also hypervigilant. And they can't make a decision, but they can be impulsive. So you have both the anxiety-based behaviors on the red box and the depressive-like behaviors in the blue box. Again, on the top, you're seeing the frequency. Under the curve is the color. The thicker the band, the more neurons are firing at those slower speeds. So we have a lot of work to do to move that patient toward the ideal pattern, but we can do that with a magnetic field stimulation, which we'll show you. So these spectral EEGs, we call them, are very diagnostic. Again, each area means something, has a certain clinical phenotype. If you look at addiction, we see a common pattern in patients with known addiction behavior. Oftentimes, their top two areas, attention span and impulse control, are very weak. So they have poor attention span, poor impulse control, by definition. That's a ADHD profile. System has a hard time paying attention, and there's some anxiety in the back of the front cortex. This is F7, F8 are regions of judgment and joy. So when you see flat leads here, patients are having poor judgment and lacking joy in things. The motor planning area in green is a bit fidgety by going fast here, which is a fidgety patient. Patient's probably bouncing their leg or twirling their hair, or has a habit maybe given the amount of fidgetiness. And then the T3, T4 is left and right ear. T3 is left, T4 is right. You're seeing a lack of waveform. Patient's not listening very well. The areas that listen are not really turned on. And then if you look down further in the vision area of the brain, P7, there's poor reading skills here. So this is a very handicapped patient who's got, by definition, poor reading skills, isn't a good listener, lacking judgment and joy, and has ADHD. So these kids are self-medicating because, as far as they're concerned, this is a broken system. It's not working. They want to move up those slow neurons and wake them up. Then they got to bring the fast neurons down with a sedative. And that's commonly how we treat, unfortunately, patients with this problem. Instead, we want to realign that center wave in the middle there and bring the slow neurons up to the right and the fast neurons down with our treatment and realign them. So, in chronic use of other medications like sleep aids, we see a slowing effect here. You see the wave being pushed over to a sleep state. That's a problem. Over time, you can see it happening here over time in a younger person where the wave is being pushed to a slow wave. That's how we go to sleep. Unfortunately, we're teaching the brain to go slower. That's a problem over time. And at some point, the brain makes a wave there. And we see this in our chronic sleep aid users, not the occasional sleep aid, but someone taking this for years. They've trained their brain to go slow. That's what we're seeing here. And the old state there on the right, the original alpha state, is being lost as we gain a new frequency at a much slower rate. We also get diagnosed things like sleep apnea. One of the things Dr. Clower and I are interested in is the bruxism, the grinding of the teeth. Patients that have generalized anxiety oftentimes will clench their teeth and jaw. That can lead to migraine and TMJ problems and headache pain. A lot of apnea patients have disruption in this as well. It could be a central apnea, or it could be an obstructive apnea, which means there's something that happens when they fall asleep in terms of a physical airway obstruction. We do very well in these patients with diagnosis and also with treatment if it's central apnea, particularly. So this pattern looks very odd, and the reason why it does is because it's a known heavily apneic patient, and that pattern is what we're seeing as the heart rate is bleeding through the entire system. So what is the process? We do a personalized form of this treatment. We take an EEG. That takes about 5 or 10 minutes. I think a lot of the folks here listening to this have had their EEG taken. We then process that data for our clients, like Dr. Clower, and we produce a protocol for treatment. And then we deliver therapy for 5 days. Then we repeat that EEG and do it again. And the goal is to continually update the patient's brainwave pattern and tighten up the signal and reduce the noise. So these devices are FDA approved. They've been around for a long time, 25 years or so. You don't feel a thing during therapy. It's about 30, 40 minutes of treatment. Patient sitting on what looks like a dental chair on the right. It's outpatient procedure. I would say 5 days a week is really typical for most of our patients. That can be inconvenient. And we treat for 4, 5, or 6 weeks in most cases. So 30, 40 treatments at 30 minutes per day. I like 5 days a week. We can do twice a day as well in some patients. But this process is an iterative process of analysis of the EEG, a protocol development, treating patients, and then reassigning a new protocol following successive EEGs. These devices, again, have been approved by the FDA for depression, migraine, OCD. A few other indications are being studied. They're very well known and common devices. The one there in Granger is a brand new one called the Apollo machine. It's the state of the art, so you're in good hands, both with Dr. Clower and his team, and with what is, I think, the best machine out there. When we pulse the brain, we're looking at the brainwave pattern in the patient. In this case, you're seeing a paddle on the forehead of my nurse here, and you're seeing the EEG headband. This is a different analysis, but we did that to prove this point. We were taking this is my one math slide, looking at the signal to noise ratio. Could I power up the patient's signal and reduce their noise? And that's what this was all about. The way we did that was we're trying to take their wave that they're making, the Y1, and amplify it using an external signal. So Y2 is going to add to Y1 and make an R. So essentially, you find the patient's best native frequency that they go to when they're calm, and we copy it. And if I give a peak frequency at their frequency, then I amplify signal, like on the right. I can also take a signal that we don't want out of the brain and reduce the signal. This is an anxiety signal that we're knocking down with our treatment. So both happen. We generally use the amplified signal approach, and we also use this displacement approach depending on the patient's symptoms. So this is again, what looks like what's happening behind the scenes in wave theory. Patients, again, don't feel this during treatment. Minor shifts can create some of that disruption. Even a small orchestra being a little bit out of tune doesn't sound right. So the brain's the same way. If we can tune up that system here and not and get rid of noise, we see improvements in patients' behaviors. So if this is a video of that. This is actually my brain showing what the brain looks like under stimulation. So while we're stimulating, in the past, we used to monitor this. You can see a 10.6 hertz wave being made. As we pull off the magnetic field, and think of that as a microcurrent field, we then see a loss of that signal. Then we hit it again, and that's the R in PRTMS, the repetition. We're going to rebuild that wave at 10.6. We're essentially making the marching band march at 10.6, which in this case is their native frequency or my native frequency. Over time, that period of alpha state becomes more durable and starts to stay. We've essentially realigned the system back to a nice signal file state from left to right here. This is going toward recovery, left to right. I should show you that this is more efficient on the right, the left being inefficient. For our kids with concussion symptoms, they oftentimes have lost this wave entirely. There's no wave. A lot of my players in the past had a complete lack of waveform, and they're performing, they're still playing, they're still starting on the team, but they've lost that edge. Their speed of thinking is slowed. They aren't sleeping as good. They might have headache. They may be self-medicating, trying to manage it themselves. As you go left to right here, you reduce those problems. Patients stop self-medicating, they sleep, their focus is better. The entire system is working better as we tune the system left to right. We know it's working because we ask the patients to tell us how it's working. In this case, we take these concussion scores. And Dr. Clower's team will give you an iPad where you can fill out a number of these tests, and we can track how your brain responds symptomatically. Lower scores are better. So in concussion, we're seeing a drop here in the symptom scores from 33 to a 10. That's a big drop in the number of symptoms. We also looked at insomnia in these patients and saw a big improvement. And then a redundant test was also done, called the Rivermead for concussion, and we see a big drop here as well. So we know patients get better as the waves get better. We wrote a paper on this some years ago about our evidence with concussion. We have one on PTSD. We have one on autism. We treat a lot of different things, and this is what I think creates a little bit of concern with my colleagues. I think Dr. Murphy's treating everything. This is crazy. My response is they all have a brain. So we're treating just the brain every time. We're treating the brain signal every time. We're tuning the piano. And then we give the piano to the piano teacher and say, or the therapist, go work with that patient now. Now that they're tuned, they'll perform better. So all these patients on the left here, examples, can be tuned. They perform differently if they are tuned. And there are cases where we can't move the brain. It's too damaged or has too much illness to it. In general, most people can be tuned, and you're treating this anatomy and tightening up their waveforms, just making their brain more efficient. And there are non-responders. As I mentioned, there are patients that just don't respond well. That's very rare, though. I want to show you a couple of typical examples that our high school kids and young kids have. It's called ADHD. You see the top two leads in these cases are not making a wave. We can see restoration. At 4 weeks it took, and then 6 weeks to build that wave back. So that's something we want to track, the Vanderbilt, which is the ADHD score. You want to track the waveform changes. It's very rewarding to see your own brain change, your child's brain change like this when it's very, very evident that there's a change here in the power of the signal and the frequency. There are things that hurt our brains. COVID is one of them. This is an example on the left of a COVID brain. We've lost all the waveform entirely. Hard to build a wave back in some older patients that have had a COVID brain. It looks a lot like Lyme's. Lyme's disease is the same thing. Neurogenic Lyme's, you probably heard of and have persons you know who've had this problem, and everything feels off. Their brain's lost power, their memory's not good, they're irritable, they have trouble sleeping. You can see in 3 weeks in a young person, we can restore most of that waveform left to right. Generalized anxiety looks like you see here on the red box, all the neurons are on the right sideline. All the big thick bands are right of the peak. They're all going too fast. Overstimulation, irritability, anger, it's all on this right side. You can see in 3 weeks a change in the waveforms here as the system is becoming more regulated. So last thing I'll show you are some developmental disorder issues and some things that we've been tracking over the years. Um, in the brain's propagation, the back of the brain on the right is sending a wave to the front of your brain. So all of us are rear-wheel driven cars. Our drivetrain's in the back on our vision system, and the front of the brain's where it propagates to. That pattern, back to front, in this case, right to left, is how the wave should be telling one part of the brain's talking to the other part of the brain in this general direction. They see something, they think, plan, judge it. They see it again, we think, plan, judge it. So this process, right to left, has to be somewhat rhythmic, where the front wheel of the bike and back wheel of the bike are the same speed. This is autism, where the front of the brain's not listening. You see the wave is propagating, but we're losing signal. By the time it gets to the front on the left, it's out of phase. It's a 4 hertz front brain talking to a 12 hertz visual system. The bike chain skipping here. It can't really communicate from back to front. They're at different frequencies, different walkie-talkie channels. One's at 12, one's at 4. We got to speed that front brain up. So in normal development, we see this as kids develop in the 3 to 5 year old age group. On the very back, on the left here bottom, you're seeing that the vision system is starting to develop color vision, some visual memory in yellow, but you don't see a lot of other development in most of our 3 to 4 year olds with their motor planning, language skills still, top leads or ADHD. The brain develops from bottom to top or from back to front. And in this case, we have normal development where you see the vision system empowered, but the rest of the brain needs a boost. That's very typical for a 3 to 5 year old. Look at the green zone on the next slide between 6 to 9 or so. You start building a wave. Kids start playing sports, riding bikes. Their motor planning is turning on in green. And a little bit of front cortex is turning on in some of these kids, which is great. That's the social skills, executive functioning. The top two leads are ADHD. Like every 5 to 8 year old has ADHD. Some parents come in and say, my son has ADHD. And I said, I know, so does every 8 year old. This is what their brain looks like. But if it's causing trouble or clinical issues or problems with school, then it's worth treating. Why let them suffer and let that area of the brain develop on its own when it's causing other issues? So I tell the parents it's normal, but I'd like to see if we can push your son along or daughter along the curve faster and bring those front leads online. That's what you see here. So watch the blue zone around 9 to 12 years old. It starts to turn on. So the first thing your brain does is says, let's get out on the field, marching band members, get out there, get your instrument in your hand, put your hat on, go warm up. Thinking, judging, planning, social skills, language, it's all in the front. And that area is becoming now active. The back of the brain is getting more rhythmic. So the drum section and the areas that are marching here, the cadence is getting clearer. The front of the brain's behind naturally, but it's catching up here. As you get to 12, 18, you see a waveform. And that front area starts to synchronize. Most of my kids that are 12 to 18 still have some ADHD. Top two leads are weak. Attention span and impulse control are still something to work on. The meditating adult, clearly, I want to move the patient looking more like her. So even the patient here on the left, we could definitely tune up and remove some of those ADHD symptoms. So this was a video of cerebral palsy. I don't know if this will play, but this is a kid I treated back about 15 years ago, Jonathan.
Yeah. All right, Jonathan, how is your sense of humor there? I'm just kidding. Good for you. So here, Dr. Kevin's going to ask you a couple of questions.
So that motion is called choreiform motion or truncal ataxia. They have a hard time staying still. He's dysarthric, has trouble speaking. His hand is clawed. This is him maybe 8 weeks after treatment started. Well, we're getting there. Okay, today is May 20th. I'm here with Jonathan. He wants to show me how quickly his hand can move open and close, which is new for him. Go ahead, Jonathan. Tell me or show me how you do it.
Take a while.
To get warmed up.
You take good.
So you can see here how he's getting, it's taking effort, but he's able to open his hand. He's much more still. His speaking becomes more clear. A lot of these kids are coming in like this with cerebral palsy, and there's not a wave to work with. We can build a wave sometimes in cases like this in the green zone, some of the yellow areas. That was enough to get his hand open, button his own shirt, use the texting on his phone. That was a big deal to at least get him here. That's about as far as we could move him. The brain was so injured, but we got him to a much better place. He would ambulate better. Definitely amazing outcome there. I'm going to show you also a video of my son. This is my son, Jack. I started treating my son back around 2013. This is him before and after treatment.
here, come here, come here, come here. Take some deep breaths. Take some deep breaths. Don't fight. Take some deep breaths.
So Jack had pretty severe autism, had very little eye contact and poor language. This is 6 months later.
So basically, I, look, if I would have had autism, Dad would not have started this whole thing. He's going around the world showing pictures of my drawings, look, my handwriting. Do you show pictures of my building?
I did show your building pictures. I showed your handwriting pictures.
Yeah, I handwrite pictures and tons of other things.
So I was lucky. He was 9 years old, had this big change, and now he's arguably off the spectrum, doesn't even qualify. In college, he just got a 101 on his calculus final, so he wants to be an astronomer. You would hardly know that he grew up until 9, being hardly verbal and had no eye contact. That's all changed dramatically. So that's a big dramatic change. We don't see in all kids. Some kids don't respond that well. This is his handwriting, gross motor skills. When you saw him originally, that's a sleeping brain. It's mean like giving you a pen at 4 in the morning, so you write your name and you're like, I'm sleeping. You had this gross motor apraxia. Around 6 months later, when you saw him speaking, he was about 7, 8 hertz. You could see the brain waking up. And then by 9 months, he was almost age appropriate. So a huge change from from here to here in 9 months. He was having OT and PT and handwriting skills, but now it was working because the brain was turned on. So that's the front of the brain in a classic autism case. Very flat front areas in blue and green. That's a apraxia of those regions they've not developed. It's an 8, 9-year-old looking brain. If you're 8, 9, it's normal. If you're 15, it's behind. Those areas should be filling in. They haven't. On the middle, you see at 3 months, this patient was treated for 2 or 3 months. You see how nice that wave forms. Then we stop, and then by 6 months, you see a stable formation of those front leads and the whole system being uniform. So it's very, very successful response left to right here. When we're trying to increase neuroplasticity. The goal of neuroplasticity is to increase this thing called dendritic arborization, which means I want more dendrites from this neuron base to this neuron base talking to each other. And the band here between regions tells you that they're on the same frequency temporarily, the same walkie-talkie channel. And the longer they stay on those stations, the more they communicate. So areas are transferring information at a better, more efficient clip when you see a band occur bigger and thicker between their regions. So this is sort of a way to look at it under a video. So I'm going to end with some blue light discussion. I want you to see how important this is. Blue light is something you've heard a lot about, blue light blockers, things like that. The visible light spectrum from 7 to 9 a.m. in most parts of the North America, second to third hour of morning sun, is largely blue, 40–50% blue of the spectrum. That's a great time to get light. All of us need it. You need to be outside, no window, no contact lenses, no glasses like these. Be outside in that 8 to 9 o'clock time period, getting natural light, not the sun per se. You can be in the shade, but you want the light exposure at 7 to 9 in the morning, every morning. If you get that light exposure, it hits your retina and tells your brain to wake up. It turns on what we call the HP axis, the hypothalamic pituitary axis, turns on your hormone cascade. And that is what tells the body it's time to increase the basal metabolic rate, your heart rate, thyroid, all that's being triggered by the light therapy. It suppresses melatonin of all hormones and a little cortisol suppression as well by getting light in the morning. That suppression wears off 12 hours later. And all of us, if we're lucky, get this peak of melatonin, and that's what puts us to sleep. If we go to bed during that period, if we delay and take our second wind, we're on the right side of the curve, we're in trouble. You want to have a sleep period right when you're going up in this big burst of melatonin. If you do, you get deeper sleep, better quality sleep. I won't go through too much of this now, but there's lots of things that rely upon good sleep, as you can imagine. And as we age, we lose that peak. And it's why we have some trouble with sleeping. As we get older, we don't have as much deep sleep because the brain's not making a melatonin burst like it used to. And that's when I suggest adding melatonin. I'm not a fan of melatonin in young kids because they can make it on their own. I want to give them light therapy. So I covered a lot there. I appreciate everyone's time, and hopefully this works out for you, Dr. Clower, and your team. You can edit things in there that you think are useful for your audience. You can also go to our link tree my link tree, and prtms.com to see more information on this. And I look forward to seeing some of you folks in person. I'll be in the South Bend area, I'm sure, several times in this year. And if I can do that and meet with you all in person, I'd be happy to go over your scans with you or your family and show you what we're seeing in the brain state. I think you're fortunate in a sense to have access to this technology. It's really a new thing. It's a really non-invasive technique that has, in my experience, almost zero side effect. It's a very light stimulus, which you can hardly feel. And it's very obvious when you see the brainwaves change that the system is adjusting. Anyway, take care. Thanks again. Thanks, Dr. Clower and your team. And Lisa, I will be in touch. Thank you.